So good day, everyone. So we're here and we're going to talk about the different kind of diseases. Well, So bago tayo magsimula, ano ba yung disease? So disease is a harmful deviation from the normal structural or functional states of an organism, generally associated with the certain signs and symptoms and differing in nature from physical injury. So here we have our first disease called mononucleosis. So mononucleosis or mono is a contagious infection na nagkakos ng Hermes virus na tinatawag na Epstein-Barr or other virus that can also cause the mono. The infection is common among teenager, young adult, and people with mono experiencing extreme fatigue, fever, and body aches. So what is the mode transmission of mono? So by Epstein-Barr or such as EBV can be transmitted through tongue kissing. And you can get mononucleosis through the direct contact. You can also spread it from sharing foods and drink to others. So ano yung cause ng mononucleosis? Mononucleosis is an illness that caused by the Epstein-Barr virus or EBV which is spread through saliva. So what are the symptoms of mono? So the most well-known symptoms of mono is extreme fatigue, forcing the infected person to nap frequently. If you experience such as extreme fatigue, accompanied by other symptoms such as swollen lymph glands and spleen, sore throats, fever, lost appetite, and muscle ache, you may want to get tested for mono. So the basis for testing whenever you have mono is the presence of antibodies produced by the white blood cells. So many people infected with mono don't get sick or have such a mild symptoms. They don't know that they have it. EBV is usual in the body to 30 to 50 days before an infected person develops symptoms. So surprisingly, 80 to 95% of adults in US have been infected by the time they're 40, but only 20% they know that they have a mono. So what is the best treatment if you have a mono? So mono is a virus, so antibiotics won't help. So we need to make sure that we get a plenty rest, eat healthy foods, and avoid alcohol because your liver may be inflamed and drinking weakness immune response. So drink plenty of fluids, and we need to take aspirin or aspirin substitute to reduce pain. To reduce pain and fever, we need to gargle salt water to relieve a sore throat and avoid the strenuous activity because your spleen may be swollen. It is important not to engage in contact sports which could rupture our spleen. So return to normal activity to quickly increase our chance of relapse. So we are here to prevention. Paano nga ba natin ma-avoid yung pagkakaroon ng mono? So we need to do first is avoiding someone with mono can be hard because the infected individuals often do not show any symptoms because the incubation period is so long. A person can be contagious 1 to 2 months before showing any symptoms, and some people don't show symptoms at all even after the signs of mono have disappeared. So a person may still be producing the virus, so a strong immune system maintained by the healthy diet, exercise, and adequate sleep can help you from getting ill. Fortunately, mono is not a very contagious and is usually only passed through intimate contact such as kissing and sharing food also. So for our intervention, there's no specific therapy available to treat infectious mononucleosis. So antibiotic don't work against a viral infection such as a mono. So treatment mainly involves taking care of yourself, such as getting enough rest, eating a healthy food and diet, and drinking a plenty water or fluids. Let's see. So our second disease is a ringworm or fungal disease. So ringworm is a common infection of the skin and nails that caused by the fungus. So the infection is called ringworm because it can cause an itchy, red, circular rash. So ringworm is also called tinea or dermatophytosis. The different types of ringworm are usually named for the location of the infection on the body. Areas of the body that can be affected by the ringworm include ear, is on the PPT. Nakikita naman natin is for the feet, tinatawag siya na tinea pedis or commonly tinatawag siya na athlete's foot. So from groin, inner thighs, buttocks is tinea crucis, cruris, cruris. Commonly tinatawag na jock itch, for skull, tinea capitis, reed, tinea barbae, hands, tinea manum, and for the toenails or fingernails, Cystinia unguinum is also called onychomycosis. So what are the symptoms of ringworm infection? So the ringworm can affect skin on almost any part of the body as well as the fingernails and toenails. The symptoms of ringworm are often depends on which part of the body is infected, but they are generally include the itchy skin, ring-shaped rash, red scaly cracked skin, and then hair loss. So symptoms typically appear between 4 to 14 days after the skin comes in contact with fungi that cause ringworm. So what are the mode of transmission of ringworm? It can get transmitted from the infected person, animal, inanimate object, and soil. So how do we prevent having a ringworm? We need to keep our skin clean and dry. Wear shoes that allows earth to circulate freely around your feet. Don't walk barefoot in any areas like locker, room, or public places or showers. Clip your fingernails and toenails short and keep them clean. Change your socks or underwear at least once a day. Don't share clothes or any other personal items with someone who has ringworm. Wash your hands with soap, running water after playing with pets. If you suspect that your pet has a ringworm, take it to see a veterinarian. If your pet has a ringworm, follow the steps to prevent the spreading the infection. If you are an athlete involved in close contact sports, shower immediately after your practice session or match, and keep all your sports gear and uniform clean. Don't share sports gear like helmet, etc. with someone with other players. So I forgot to include the treatment of ringworms. So Tinea pedis or athlete's foot can usually be treated with over-the-counter tropical antifungal products such as the ribinafine appears to the most effective, but other agents can also be used. The chronic or extensive tinea pedis may require the treatment with oral antifungal agents such as terbinafine, intraconazole, or fluconazole. In additional, chronic tinea pedis may require adjunctive therapy such as foot powder or talcum powder to prevent the skin maceration. So for the chicken pox, so alam naman natin na siguro ito. So we're going to talk about this. So pox is an infection na cause ng Viscerella zoster virus. So it causes an itchy rash with small fluid-filled blister. Chickenpox is highly contagious to people who haven't had the disease or been vaccinated against the chickenpox. Today, a vaccine is available that protects the children against chickenpox. So routine the vaccination is recommended by the U.S. Center for Disease Control and Prevention (CDC). The chickenpox vaccine is safe, effective the way you prevent chickenpox and its possible complication. What are the symptoms of chickenpox? So the symptoms of chickenpox, it is itchy blister rash na nagkakos ng chickenpox infection na nag-appears from 10 to 20 days after the exposure to the virus and usually lasts about 5 to 10 days. Other signs and symptoms which may appear 1 to 2 days before the rash includes dito yung fever, lost appetite, headache, tiredness, and generally feeling of being unwell. So other the chickenpox rash appears, it goes through the 3 phases. So raised pink or red pumps, which break out over the several days. A small fluid-filled blister, which form in about 1 day and then break and leak. Cross and scalds, which cover the broken blister and take it several more days to heal. So what is the mode transmission of chickenpox? So a person to person by direct contact, and then the droplets or airborne spread of vesical fluid secretion of the respiratory tract of chickenpox cases. Vesical fluid of patient with herpes zoster and direct through articles freshly soiled by discharge from vesical and mucous membrane of infected person. So how do we prevent a chickenpox? So set up the sick room for a family member infected, avoid those infected, don't share dishes with a sick person, don't kiss anyone with a virus, disinfect the non-porous surface, get vaccination, wear a disposable or non-latex gloves. So for ins- for eczema is the main symptoms of eczema is itchy, dry, red, and flaky, inflamed with irritated skin. It can flare up, subside, and then flare up again. Eczema can occur anywhere but usually affect the arm, inner elbow, back of the knee, cheeks, and scalps. It's not contagious with something because less severe with age. So other symptoms may include the intense itchy, red or brownish gray patches, small raised bumps that ooze fluids when scratched. So crusty punch and direct yellowish ooze, which can signal infection. So sore throat, sore or raw feeling skin. So many people will find their symptoms get worse at night, making it difficult for them to sleep. Scratching eczema further irritates and inflames the skin. This can also infection that must be treated with antibiotics. Sometimes mild eczema can be managed at home by avoiding trigger and keeping skin moisturized. However, it's best to see a doctor when symptoms are hard to manage or are getting worse. So, what are the symptoms of eczema? So, the symptoms of eczema is the main symptoms of eczema is itchy, dry, rough, flaky, inflamed, and irritated skin. It can flare up to subside and then flare up again. Eczema may occur anywhere, but usually affect the arm, inner elbow. So other symptoms may include the intense itchy, red, brownish gray patches, and thick, scaly skin, sore and dry feeling of skin. So what are the best treatment for eczema? A dermatologist, allergist, or primary care doctor can help you to identify the correct treatment for eczema. So the right treatment for you is will depend on the type of severity of your eczema. You can might find it helpful to combine more than one treatment. That option include here is a medication, oral over-the-counter or OTC, antihistamine can relieve itching. Example includes dito is cetirizine, diphenhydramine, and then other medication. you can also use ointment or cream that can relieve the itchy and scaling, but they can have a side effect after a long-term use, including the thinning of the skin, irritation, and discoloration. How is eczema prevented? So, paano nga ba? So, you can take a step to prevent eczema by flare-ups. You and your doctor can discuss some of the changes that might work best for you. So, common step to prevent flare-ups includes reducing stress, avoid no triggers, keeping your skin clean, reducing shower of bath times to 10 minutes or less, avoiding very hot shower or bath water, keeping skin moisturized, using a dye and scent-free laundry, bath and makeup product, taking any prescription as direct, avoiding itchy skin. So here is a tuberculosis. So a person may develop a TB or such as the tuberculosis after inhaling the Mycobacterium tuberculosis or M. tuberculosis bacteria is primarily from person to person. When TB is affected the lungs, the disease is most contagious, but the person will usually only become sick after the close contact with person who has this type of TB. We have the two types of TB: TB infection, latent TB, TB disease, active TB. So ano ba yung TB infection or latent TB? As an individual can have a TB bacteria in their body and never develop the symptoms. In most people, the immune system can contain the bacteria so that they do not replicate and cause disease. In this case, a person will have a TB infection but not active disease, so doctor refers to the to this as a latent TB. So an individual may never experience the symptoms and be unaware that they have the infection. There is also no risk of passing on the latent infection to someone else. However, a person with a latent TB still requires treatment. The CDC estimates that as many as 13 million or trusted source people have a latent TB. So for the TB disease or active TB naman, the body may be unable to contain the TB bacteria. This is more common when the immune system is weakened due to illness or use to certain medication. When this happens, the bacteria can replicate and cause symptoms resulting in active TB. People with active TB can spread an infection. And without medication, the TB becomes active in 5 to 10% trusted source. Um, Trusted source of the people with infection, according to CDC, progression occurs with 2 to 5 years. In about 50% of these people, the risk of developing active TB is higher. So what are the symptoms? So katulad nga ng sinabi natin kanina, a person with a latent TB will have no symptoms and no damage will show on the chest X-ray. However, a blood test or skin prick test will indicate that they have a TB infection. So active TB, an individual with TB disease may experiencing a cough that produce the phlegm, fatigue, a fever, chills, and then lost appetite and weight. Symptoms typically worsen over the time, but they can also spontaneously go away in return. So this is the early warning sign: a persistent cough lasting at least 3 weeks, which, which may have a blood in it. When they cough, a lost appetite and weight, a general feeling fatigue and being unwell, swelling in neck, a fever, night sweat, and chest pain. And for the treatment, with early detection of appropriate antibiotics, TB is tractable. Then the right type of antibiotics and length of treatment will depend on the person's age and overall health. Whenever they have a latent or active TB, the location of the infection, whenever the strain of TB is drug resistant. So treatment for latent TB can be very. It may involve someone with taking antibiotic once a week for 12 weeks or every day for 9 months. Treatment for active TB maybe involves taking several drugs for 6 to 9 months. So when a person had a drug resistant strain or TB, the treatment will be more complex. It's essential for the people to complete the full course of treatment, even if the symptoms is go away. If a person stop taking their medication early, some bacteria can survive and become resistant to antibiotics. So in this case, the person may go on to develop drug-resistant TB, depending on the parts of of the body that TB affects. So as the doctor may also prescribe corticosteroid. And then for the prevention, I forgot to include to my PPT is the way to prevent the TB from the infected. Other includes is getting a diagnosis and treatment early, staying away from the person until there's no longer risk of infection, wearing masks, covering the mouth, and ventilating rooms. So that's it for our five diseases. So for other five kind of diseases, my partner will be reporting next. So thank you. That's all.
So hi, I am Antoinette Andre Villena and I am from section BSN 1F, and today I'll be discussing 5 diseases. So as for the first disease, it is the Lyme disease. So Lyme disease is the most common vector-borne disease in the United States. Lyme disease is caused by the bacterium Borrelia burgdorferi and rarely Borrelia mayani. It is transmitted to humans through the bite of infected back-legged ticks. Typical symptoms include fever, headache, fatigue, and the characteristic skin rash called erythema migrans. So the Lyme disease bacterium Borrelia burgdorferi is spread through the bite of infected ticks. Ticks can attach to any part of the human body but are often found in hard-to-see areas such as the groin, armpits, and scalp. In most cases, the tick must be attached for 36 to 48 hours or more before the Lyme disease bacterium can be transmitted. Most humans are infected through the bites of immature ticks called nymphs. Nymphs are tiny, less than 2 millimeter, and difficult to see. They feed during spring and summer months. Adult ticks can also transmit Lyme disease bacteria, but they are much larger and are more likely to be discovered and removed before they have had the time to transmit the bacteria. While adult Ixodes ticks are most active during the cooler months of the year. So now moving on to the signs and symptoms. Untreated Lyme disease can produce a wide range of symptoms depending on the stage of infection. These include fever, rash, facial paralysis, and arthritis. So as for the early signs and symptoms, which is 3 to 30 days after tick bite. So we have fever, chills, headache, fatigue, muscle and joint aches, and swollen lymph nodes may occur in the absence of rash. And there's also erythema migrans or EM rash, which you can see on the photo. So erythema migrans occurs in approximately 70 to 80% of infected persons. It begins at the site of a tick bite after a delay of 3 to 30 days, which is an average is about 7 days. So it expands gradually over several days, reaching up to 12 inches or more, or 30 centimeters across. May feel warm to the touch, but it is rarely itchy or painful. Sometimes clears as it enlarges, resulting in a target or bullseye appearance. It may also appear on any area of the body, does not always appear as a classic erythema migrans rash. So now as for the later signs and symptoms, which is days to months after tick bites, Severe headaches and neck stiffness, additional EM rashes on other areas of the body, facial palsy or loss of muscle tone or droop on one side or both sides of the face, arthritis with severe joint pain and swelling, particularly at the knees and other large joints. There's also intermittent pain in tendons, muscles, joints, and bones. There's also heart palpitations or an irregular heartbeat, which is Lyme carditis or carditis. So next is episodes of dizziness or shortness of breath. There's also inflammation of the brain and spinal cord, nerve pain, shooting pains, numbness, or tingling in the hands or feet. So now as for the treatment. Lyme disease is best treated in the early stages. Treatment for early localized disease is a simple 10 to 14 day course of oral antibiotics to eliminate the infection. Medications used to treat Lyme disease include doxycycline, amoxicillin, or cefuroxime, which are the first line treatments in adult and children. Cefuroxime and amoxicillin, which are used to treat people who are breastfeeding. Intravenous or IV antibiotics are also used for some forms of Lyme disease, including those with cardiac or central nervous system involvement. After improvement and to finish the course of treatment, healthcare professionals will typically switch to an oral regimen. The complete course of treatment usually takes 14 to 28 days. Lyme arthritis, which is a late-stage symptom of Lyme disease that may be present in some people, is treated with oral antibiotic for 28 days. So now as for the nursing interventions for Lyme disease. So first assess skin for rash, then monitor vital signs, perform 12-lead ECG, apply cool compresses to swollen and painful joints. Provide and promote calm, low-stress environment. Assist with ROM exercises. Administer medications appropriately. And then lastly, educate patients and family members on ways to reduce risk of Lyme disease. So now as for the second disease, Chagas disease is named after Brazilian physician Carlos Chagas, who discovered the disease in 1909. It is caused by the parasite Trypanosoma cruzi, which is transmitted to animals and people by insect vectors and is found only in Americas, mainly in rural areas of Latin America, where poverty is widespread. So Chagas disease or T. cruzi infection is also referred to as American trypanosomiasis. So now for the mode of transmission of Chagas disease. People can become infected in several ways. In areas where Chagas disease is common, the main way is through vector-borne transmission. The insect vectors are called triatomine bugs. These blood-sucking bugs get infected with T. cruzi by biting an infected animal or person. Once infected, the bug pass the parasites in their feces. The bugs are found in houses made from materials such as mud, adobe, straw, and palm thatch. During the day, the bugs hide in crevices in the walls and roofs. During the night, when the inhabitants are sleeping, the bugs emerge because they tend to bite people's faces. Triatomine or triatomine bugs are also known as kissing bugs. After they bite and ingest blood, they defecate or poop on the person. The person can become infected if T. cruzi parasites in the bug feces enter the body through mucous membranes or breaks in the skin. The unsuspecting sleeping person may accidentally scratch or rub the feces into the bite wound or into the eyes or into the mouth. So people can also become infected through congenital transmission from a pregnant woman to her baby. Also through blood transfusions, organ transplantation, consumption of uncooked food that is contaminated with the feces from the infected triatomine bugs, and accidental laboratory exposure. It is generally considered safe to breastfeed even if the mother has Chagas disease. However, if the mother has cracked nipples or blood in the breast milk, She should pump and discard the milk until the nipples heal and the bleeding resolves. Chagas disease is not transmitted from person to person, like a cold or a flu, or through casual contact with infected people or animals. So for the signs and symptoms of Chagas disease. Chagas disease can cause a sudden, brief illness or acute, or it may be a long-lasting or chronic condition. Symptoms range from mild to severe, although many people don't experience symptoms until the chronic stage. So let's talk about the acute phase. The acute phase of Chagas disease, which lasts for weeks or months, is often symptom-free. So when signs and symptoms do occur, they are usually mild and may include swelling at the infection site, fever, fatigue, rash, body aches, eyelid swelling, headache, loss of appetite, nausea, diarrhea or vomiting, swollen glands, and enlargement of your liver or spleen. Signs and symptoms that develop during the acute phase usually go away on their own. In some cases, if the infection isn't treated, Chagas disease will advance to the chronic phase. So now as for the chronic phase, signs and symptoms of the chronic phase of Chagas disease may occur 10 to 20 years after initial infection, or they may never occur. In severe cases, Chagas disease signs and symptoms may include irregular heartbeat, heart failure, sudden cardiac arrest, difficulty swallowing due to enlarged esophagus, stomach pain, or constipation due to enlarged colon. So now let's talk about the treatment for Chagas disease. So the treatment focuses on killing the parasites and managing signs and symptoms. During the acute phase of Chagas disease, the prescription of medications benzidazole and nifortimox or Lampit may be of benefit. Both drugs are available in the regions most affected by Chagas disease. In the United States, however, the drugs can be obtained only through the Centers for Disease Control and Prevention. Once Chagas disease reaches the chronic phase, medications won't cure the disease. But the drugs may be offered to people younger than age 50 because they may help slow the progression of the disease and its most serious complications. Additional treatments depends on the specific signs and symptoms. Heart-related complications. Treatment may include medications, a pacemaker, or other devices to control your heart rhythm, surgery, or even a heart transplant. As for digestive related complications, treatment may include diet changes, medications, corticosteroids, or in severe cases, surgery. Now, as for the nursing intervention, nursing management involves adequate care plans since most of the medical regimen is of symptomatic treatment. Proper assessment of disease prognosis is helpful to visualize the possible damage and complications that might happen, so as that the medical intervention could be done immediately. Next is health education regarding the disease prevention is vital since no vaccine is yet available on the market. Ongoing research is being conducted. Lastly is the sanitation and cleanliness. Body, environment, food ingested plays a big role in averting the presence of these bugs. So next disease is jock itch. It is an infection that is caused by a fungus. It is a form of a ringworm that likes to live in warm, moist places on your body. It's also called Tinea cruris. People who sweat a lot, who are overweight, or who have skin condition called eczema are more likely to get it. It is a common problem for male athletes, which is how it got its name. But you don't have to play a sport or be a guy to get it. So, mode of transmission. Jock itch is contagious and can spread from one person to another by skin-to-skin contact, especially in warm, damp environments. It can also spread to other areas of the body if someone touches the affected area and it touches the other body parts. Jock itch often spreads from a fungal infection on the feet known as athlete's foot. Jock itch can affect anyone who tends to sweat a lot. It most often affects boys, but girls can also get it. Things that can make jock itch more likely to include more. So things that can make jock itch more likely include lots of sweating while playing sports, hot and humid weather, um, friction from wearing tight clothes like bathing suits for long periods of time, sharing clothes or towels with others without drying the skin well after sweating, bathing, or swimming. Some health conditions such as diabetes, obesity, or immune system problems. So, signs and symptoms, jock itch or tinea cruris usually causes redness, flakiness, peeling or cracking of the skin in the groin, thighs, and buttocks area. The rash can look circular with well-defined or even elated edges. It can also spread to the area around the anus where poop comes out. It may itch, sting, or burn, or simply feel uncomfortable. So now let's move on to the treatment of jock itch. So over-the-counter or OTC antifungal creams, sprays, or powders may solve the problem if it is mild. More serious infections may need prescription medicine, either topical or in pill form. Your child should use the medicine as long as it is recommended, even if the rash seems to be getting better. If not, the infection can come back. Some people regularly use medicated powders and sprays to prevent this from happening. To help heal the skin, it is important to keep the affected area clean and dry. Your child should wash and dry the area with a clean towel. A separate clean towel should be used for the rest of the body. Then, apply the antifungal cream, powder, or spray as directed on the label. And then change clothing, especially underwear, every day. So next is treat any other fungal infection such as athlete's foot. So now as for the nursing interventions. First, provide general nursing care for fungal skin diseases, which focuses on enhancing skin integrity, providing pain relief, preventing infection, and providing client and family teaching. Next is administer prescribed medications, which may include topical antifungal medication for mild conditions and griseofulvin or terbinafine for severe conditions. Instruct the client to avoid excessive heat and humidity as much as possible, including avoiding wearing nylon underwear, tight-fitting clothes, and wet bathing suits. Next is advise patients with tinea cruris to dry the crural folds completely after bathing and to use separate towels for drying the groin and the other parts of the body. Next is instruct the client to clean, dry, and dust the groin area with a topical antifungal agent. Next, advise patients with tinea cruris to avoid wearing tight-fitting clothing to prevent moisture buildup. Next is advise patients with tinea cruris who are obese to lose weight. Next, advise patients to put on socks before undergarments to minimize the possibility of fungal transfer from the feet to the groin. And then lastly, antifungal powders, which have the added benefit of drying the region, may be helpful in preventing the recurrence of tinea cruris. So now let's move on to the next disease, which is giardiasis. Giardiasis is a diarrheal disease caused by the microscopic parasite Giardia duodenalis, or Giardia for short. Once a person or animal has been infected with Giardia, the parasite lives in the intestines and is passed into stool. So, once outside the body, Giardia can sometimes survive for weeks or even months. Giardia can be found in every region of the United States and around the world. So how can you get giardiasis? So you can get giardiasis if you swallow the Giardia parasite or germ. Giardia or poop from people or animals infected with Giardia can contaminate anything it touches. Giardia spreads very easily. Even getting tiny amounts of poop in your mouth could make you sick. So giardiasis can be spread by swallowing unsafe food or water contaminated with Giardia germs, having close contact with someone who has giardiasis, particularly in childcare settings. Next is traveling within areas that have poor sanitation. Exposure to poop through sexual contact from someone who is sick or recently sick from Giardia. Next is transferring Giardia germs picked up from contaminated surfaces such as bathroom handles, changing tables, diaper pails, or toys into your mouth. So next is having contact with infected animals or animal environments contaminated with poop. So some people with giardiasis have no symptoms at all. If signs and symptoms do develop, they may vary and usually begin 1 to 2 weeks after becoming infected with giardia. So short-term symptoms include diarrhea, gas, foul-smelling or greasy stools that tend to float, stomach cramps or pain, upset stomach or nausea, vomiting, dehydration or loss of fluids. So, symptoms of giardiasis generally begin by having 2 to 5 blue stools per day, with progressively increasing fatigue. Other less common symptoms include fever, itchy skin, hives, and swelling of the eyes and joints. Over time, giardiasis can also cause weight loss and keep the body from absorbing nutrients it needs, like fat, lactose, and vitamin A, and also vitamin B12. So some people with giardia infections have no symptoms at all. So children and adults who have giardia infection without symptoms usually don't need treatment unless they're likely to spread the parasites. Many people who do have problems often get better on their own in a few weeks. When signs and symptoms are severe or the infection persists, doctors usually treat giardia infection with medications such as metronidazole. Metronidazole is the most commonly used antibiotic for giardia infection. Side effects may include nausea and a metallic taste in the mouth. Don't drink alcohol while taking this medication. Next is tinidazole. Tinidazole works as well as metronidazole and has many of the same side effects, but it can be given in a single dose. Lastly is nitazoxanide. Because it comes in a liquid form, nitazoxanide may be easier for children to swallow. Side effects may include nausea, gas, yellow eyes, and brightly colored yellow urine. If you have diarrhea, drink a lot of fluids while sick to avoid dehydration or loss of fluids. So nursing interventions for a child with giardiasis include the following. So first is restore fluid and electrolyte balance. So weigh the patient daily and note decreased weight. Record number and consistency of stools per day. If desired, use a fecal incontinence collector for accurate measurement of output. And then monitor and record intake and output. Note oliguria and dark concentrated urine. Discuss the importance of fluid replacement during diarrheal episodes. And then next is reduce pain or discomfort. So assess the extent and characteristics of pain. Give a warm compress on the abdomen. Teach the client and caregivers about methods to distract from the pain. And set a position that can reduce the pain. Lastly is improve hyperthermia. So provide tepid sponge baths. Administer antipyretics as prescribed. So now as for the last disease, we have shingles or herpes zoster. So shingles is a viral infection that causes an outbreak of a painful rash or blisters on the skin. It is caused by the varicella zoster virus, which is the same virus that causes chickenpox. So the rash most often appears as a band of rashes or blisters in one area of your body only. So shingles is caused by varicella zoster virus or VZV. So the same virus that causes chickenpox. After a person recovers from chickenpox, the virus stays dormant or inactive in their body. The virus can reactivate later, causing what we know as shingles. So most people who develop shingles have only one episode during their lifetime. However, you can have shingles more than once. If you have shingles, direct contact with the fluid from your rash blisters can spread VZV to people who have never had chickenpox or never received the chickenpox vaccine. If they get infected, they will develop chickenpox, not shingles. So they could then develop shingles later in life. So the risk of spreading VZV to others is low if you cover the shingles rash. So people with shingles cannot spread the virus before the rash blisters appear or after the rash crusts. So people with chickenpox are more likely to spread VZV than people with shingles. So early symptoms and early symptoms of shingles may include fever, chills, headaches, feeling tired, sensitivity to light, and stomach upset. So as for other signs and symptoms that may appear, a few days after the early symptoms include itching, tingling or burning feeling in area of your skin, redness on your skin in the affected area, raised rash in a small area of your skin, and then fluid-filled blisters that break open then scab over. And then lastly is mild to severe pain in the area of skin affected. So there is no cure for shingles, but there are treatments for managing the symptoms. So there are antiviral medications. So these drugs may ease the discomfort and make the symptoms stop sooner, particularly if you start them within 72 hours of the first sign of shingles. So they may also help prevent the pain that can happen months and years later called post-therapeutic neuralgia. These medications include acyclovir, famciclovir, valacyclovir. So next, as for the over-the-counter pain medications, these medications include the following and may be effective in relieving pain. So acetaminophen and ibuprofen. So now as for the nursing interventions for shingles. So first is assess pain level. Then next, apply cool moist dressings to lesions while in vesical stage. Discontinue once lesions begin to crust. Administer medications and apply topical steroids, antihistamines, and analgesics as necessary. And then assess for signs and symptoms of bacterial infections on skin and obtain culture and sensitivity test as indicated. Next is initiate contact precautions. Then assess for changes in vision and rash on forehead or nose. So now that is all about the 5 diseases that I have discussed.